I'm in the Arizona area. Anybody can reach me, and anybody can have a consultation with me because we treat globally. You can reach me at 480-703-0151 if you would like a consultation, and I will send you a free gift for doing so. We're going to talk a little bit, just kind of briefly, about the after effects of COVID. Many friends, patients, and family said to me that they don't feel the same since they had COVID. Not everybody I know had COVID, but for the people that did, they say it changed them. I believe that because it was so devastating of a virus, because it went so deep into your nervous system, and because many of you had the vaccination. I did. I ended up with cancer. COVID has an effect that it leaves on you. Just like, let's examine briefly chickenpox. Chickenpox has a long range after effect that lays dormant in your nervous system. Among the after effects are herpes, shingles, COPD, lots and lots of nasty things, HPV, lots of nasty things that chickenpox can bring about, more so herpes and shingles. And shingles will travel along a nerve line as a rash or blisters. Mucous membrane lines around the eyes, mouth, same as herpes, around the tummy, the buttocks, the private parts. You know when it's coming because you feel it. You feel a tinging or a burning or an itching, and then you see the rash appear. Now, if chickenpox could do that, why couldn't COVID? Because COVID was such a pandemic, it left people with after effects of being exceptionally tired. They no longer feel themselves. They don't have the energy anymore. Mental focus. People have short-term memory. They're forgetting things. They can't put their finger on what they were supposed to do next. Vision problems. Their vision is less. It's cloudy. It's not what it should be. It changed. COVID left other effects on people. Heart problems, whether or not you heard about that after the vaccination. I don't even want to bring up that vaccination again because it was the most horrible thing you could do to your body. Now, everybody's going to fight me that agrees with the vaccination. And you can fight me. I don't care. Because I feel the way I feel and you feel the way you feel. I'm not going to fight you for getting the vaccination because I was stupid enough to get one myself. Pretty much I was forced to, being in the medical field. But when masks were not enough, they suggested you get the vaccination. One was not enough. Then they said 2. Then they said a booster. Then they said 4. Hey, when does it end? You know when it ends? It ends when another horrible pandemic surfaces. So now they're looking at monkeypox. Do you know what monkeypox are? They're horrible. You get it from skin-to-skin contact. It looks like nodules all over your body, everywhere, especially on your hands. Why? Because your hand, you touch people. You shake hands with people. You don't know if they have the virus. Let's hope the monkeypox doesn't go into another pandemic because that is a cruel looking virus. It is cruel. If you haven't seen it, you need to check the internet and look up monkeypox. I believe they had monkeypox surface years and years ago, and it's come back again, like so many viruses will. It's kind of a pendulum, they come back, they swing back around. Let's hope we're done with polio. Well, now we have vaccines for polio, but I'm getting off track. Let's go back to COVID. Did it leave you with lower backaches, less strength, less motivation? Can't think straight, like I said. Mental focus is bad. Oh my gosh. So many people say, I haven't been the same since I had COVID. I have a long-term cough, a deep, deep upper respiratory cough that just never ends. My teeth rotted. I don't know what happened to my teeth, but they're not the same. Now I have toothaches, I have cavities, I have this, I have that, my gums swell, they bleed. Constant headaches, migraines. Some people say COVID left them with a change in their skin. Crepey, dry, things like that. COVID can leave you with dry mouth, frequent nosebleeds, gums bleeding. It could have affected the eardrums. It could have affected many things because, once again, it was a very devastating, deep pandemic that wasn't just in the United States. It was all over the world, and you know that. So why wouldn't it have long-lasting effects after you have had COVID? Let's talk about how you can overcome the after effects of COVID. I mean, if that virus was strong enough to kill people, how many people have you seen? Have you heard about the news? Of course, you know how the media is. They overblow everything. They'll go way out and say things that aren't true. But how many people have died? Go to the hospital. Now you're on an inhalator. You can't breathe, so they have you on controlled breathing. And then they die. Why? Because their lungs fill up with mucus and they can't breathe, and then they get pneumonia, and ta-da, they die. Pneumonia, the last step. Some people call it the old people's friend. You have heart disease, you go into the hospital, you can't move around, you're bedbound. And what are the chances? Hey, pneumonia. That's the chance. And death follows, unless you're lucky enough to come out of it. Well, this is what happened with COVID patients that went into the hospital, and they were put on respirators. Some of them made it, most of them did not. Now, that's how dangerous that virus was and still is. However, they have a little bit more control over it now. And like I say, with a new virus coming up, the less you're going to hear about COVID. You don't hear on the news very much anymore about how many new cases are there today, how many new people died. You used to hear that several times a day on the news, and that's enough to spook anybody. But you don't hear much of that anymore because it kind of played itself out. Went all over the world, kicked our butts, and now you hardly hear about it, and most people don't even think about it anymore. You see some people still wearing their masks. Good idea. You see some people still keeping distance from one another in stores and things like that. Great idea. I would always do that just in case, especially in the flu season. So now you're hearing about all the variants that COVID put out there. And so now you're scared of the variants. Well, it's okay to be afraid because that means you're going to protect yourself. How many days and nights did we spend confined in our homes during the COVID scare? Long enough to drive a lot of people crazy that they couldn't be with their friends. They couldn't go out their door. They were scared to death. That was a horrible pandemic. Okay, let's talk on a brighter side. Let's talk about how do we overcome it. I've had patients call me and say, I'm a long hauler. I have a lot of effects of COVID. Help me come out of this. And I do. I have the right medications for the right symptoms of how COVID left you feeling. All you have to do is call me. I'll take a case history on you. I know there's a lot of you out there and you don't know what to do, but the medicine I have will bring you out of that long haul. You don't want to be a long hauler. You want to get back to your normal living again, your normal life. Feel normal again. A lot of people don't, especially elderly people. It hit them really hard. Kids, kids can come out of it. They have an immune system that pretty much doesn't quit. Why? Because they're active. And when you're a child and you're active and you're out there and you're in school and you're exercising and playing ball and doing this and running, and that increases your stability of your immune system. And your immune system grows stronger. And when you are older or elderly, your immune system hits the wall because we're not doing the things we're supposed to do. A lot of you don't even care about what you're eating. You're just eating anything really bad. You have to learn how to eat right. And eating right doesn't mean in the morning you're going to have sausages and toast and this and that, and bacon, eggs. That's disgusting. Eating right means lots of vegetables, lots of whole grains, lots of nuts and things like that, fruits, and most people, that's just not their bag. Okay, so you're not nourishing the body the way you should to keep your immune system up and running and kicking butt. You need to eat right. It's all about what you eat. It's anything that you eat is going to affect your body one way or the other, whether it affects your organs, the production of your organs, or your skin, which is the largest organ of our body. Eating wrong, you are what you eat. How many of you remember hearing that a million times? You are what you eat, and boy, it's true. So now you spent enough time in your homes during COVID to do nothing but eat. Some of you were lucky enough to keep your jobs online, so you kept working. Some of you weren't that lucky. You still had to go out and subject yourself to more COVID problems, being near other people. So wearing a mask isn't all that protection that you would hope it would be when you have to be around people during a pandemic. You definitely don't want to use a public bathroom. That's the first thing you don't want to do. If you're home and you have a pandemic or a virus going on through your house, spray that toilet with disinfectant every time you use it, every time someone else uses it. That's how to cut down on catching what somebody else in your house has. Flu, right up there, number 10. So protect yourselves. Use your head. Protect yourself. Keep yourself well. Exercise. Eat right. Sleep the amount of hours that your body needs. Some people only need 4 hours. Some need 6. Some need 8 and 10. It's okay. Your body knows when it has to wake up. It will awaken when it's done resting. Did you know that? You don't have to live by a clock. Unless you have to report for work at a certain time, you can't be late or you'll be fired. Use your alarm. But your body will awaken when your brain is done sleeping. Bingo, I'm awake. Maybe it's 2 a.m. in the morning. I don't know. Should I get up and exercise? Great idea. Is that foolish? Not if your body says it's ready to go. 5 in the morning, 8 in the morning, whatever your bag is, hey, follow it. Follow what your brain tells your body to do. The medicines I have to fight this long haul with this COVID after effect are extremely strong and effective, although they're all homeopathic, so they will never hurt you. They won't destroy your organs the way the vaccines do. They won't hurt you in the long run. They will help you. And the medicines are prepared very scientifically. I get all of my medicines from Germany or London. Nothing from the USA, because they don't make medicines out here to cure you. They make medicines out here to suppress your medical problems. I'm not talking about homeopathy. I'm talking about a drug prescription. They don't cure anything. They just suppress everything, keep you going, like a Duracell battery. But when it runs out, it runs out. There's nothing you can do about recharging. So homeopathy is a sure way to cure in the shortest amount of time with the easiest way possible for your body. Doesn't hurt your organs. A lot of people don't believe in homeopathy because they're not sure of what it is, and they hear natural medicine and they think, oh, foo-foo. Natural medicine not going to do nothing for me. It's a bunch of plants and all that stuff, herbs. I don't use herbs or plants. I use real medicine without toxin. And all these medicines were made from the earth or organs. And they work. They are supremo. They work. If you don't know anything about homeopathy, you cannot knock it and say it's not true and it doesn't work. What are your chances then? Your chances are you have to take a prescription drug. Good luck with that. I'm not telling you prescription drugs are all bad. I love antibiotics. Hey, they work. They keep you well when you need them. I like some prescription drugs. I do, especially when they're going to keep your heart beating or your blood pressure down so you don't blow a tube and bleed to death, or stroke out. There's a lot of reasons why I agree with prescription drugs, but I disagree with them curing you because they don't. Like I said, they just keep your body running. Okay, so they give you a few more years. That's fine. You're still going to die because nothing cured you. Everybody's going to die. Let's not die because COVID left us in a bad space. Let's get well. Let's get rid of the after effects of COVID. Let's do what we have to do for our bodies to live right, eat right, exercise, push yourself. You have to. You push your brain every day, I hope, because if you don't, your brain's going to turn to marshmallow. You're not going to be much of a person. You have to exercise the brain. It's a muscle, just as well as you have to exercise your body. I don't care if you're 60, 40, 70, 80, and some people 90 are lucky enough to live healthy and wise. And they don't forget things and they keep on going. Why do they keep on going? Because they never shut down. The minute you shut down, it's over for you. I'm giving you some really good advice. I hope you're listening to me. But I've been on my soapbox long enough. I gave you my message. I hope you accept it. I hope you do something about it if you are suffering from COVID. If you don't know if you're suffering from COVID, call me anyway. We can do a case history and I can tell you yes or no. I'm very truthful. I don't pull any punches. I tell my people the way it is. If you don't want my answers, don't ask the question. That's how frank and open I am with my patients. And I think they really appreciate that because I pull no punches with anyone, particularly my patients, who have the right to know everything about their health. Remember that when you go to your primary care doctor, you are the patient, you have patient rights. You insist on your rights. And if they refuse, go get another doctor. They're on every street corner, just like beauty salons, I've said enough. I'm Dr. Bernie. Again, you can reach me at 480-703-0151. Please go to my website, www.gilbertnaturalmedicine.com, and enjoy my website. It is absolutely phenomenal. It's a great website. You'll learn from it. A lot of things that you want to learn from my website. I'm going to try and get out of here. I don't know if I can, but I'm going to do my best to end this little chat here. Okay, take care. We may talk again in the near future. If there are any things that you would like to hear me talk about that's in my capacity of, my knowledge, then I will. If there's any medical thing you want to discuss, that's fine. Let's try and do that. See you again.